Hello, everyone, and on behalf of the Health Education Committee and the WYHF, I am hereby extend a warm welcome to our honorable guest, Dr. Dhiren Shah, and to all the attendees who have joined us for this webinar today. So just before we come to the main highlight of today's event, I would like to say a few words about WYHF, that is the World Youth Heart Federation. So basically, WYHF is an international non-profit organization which is working towards improving cardiovascular health in the society. And as the name suggests, it's basically aiming population which is under 35 years of age. And one of the central values or the core principles which guides our vision, or which is dear to us, is intersectoral collaboration. And this is reflected in our standing committees, which are represented by the acronym HEART, where E stands for entrepreneurship, A stands for advocacy, R stands for research, and T for technology. That reminds me, all the attendees over here will be getting certificates from WIHF at the end of the session, for which you have to fill a small form with relevant details, the link of which we'll be sending to you at the end of the webinar. And now coming to today's topic, that is heart transplantation, the future. So as we all know, cardiac surgery, and within cardiac surgery, heart transplantation is a milestone when it comes to cardiac. And right from the inception of cardiac transplantation in 1967, where life expectancy was just about 18 days, today, where the expectancy is much more, it goes up to sometimes even more than a decade. We've come a long way. And to talk about the challenges that cardiac transplant surgery faces today and ways in which we can overcome these challenges in the near future, we have Dr. Dhiren Shah with us. Thank you, sir, for joining us. So Dr. Dhiren Shah is a very well-reputed cardiovascular and thoracic surgeon. He's currently the director at SIMS Hospital, Ahmedabad, where he is also a consultant cardiovascular and thoracic surgeon and also the chief transplant surgeon. He is also the pioneer in minimally invasive cardiac surgery in Western India. And Dr. Shah has in fact several firsts to his credit. For example, he is the first to perform a transaortic transcatheter aortic valve replacement, or TAVR, in India. He's the first surgeon to perform a successful heart transplant surgery in Gujarat. He's the first person to perform a hybrid coronary artery bypass grafting, or CABG, surgery in India. And he's also the first person to perform a CABG surgery on a patient as young as 8 years in the state of Gujarat. With guidance from some internationally acclaimed surgeons such as Alain Carpentier, Dr. Fan, and Dr. Friedrich Mohr, Dr. Shah has perfected his skill and has an experience of over 10,000 open heart surgeries. He's also an executive council member of the Indian Society of Heart and Lung Transplantation and member of the Executive Committee of Health Ministry by the Government of India and ICMR for establishing standard treatment guidelines for cardiac surgery in India. In addition, Dr. Shah is also involved in spreading awareness about organ donation. Dr. Shah, it's an honor to have you with us today. And once Dr. Shah is done with his oration, we will be having a question and answer session where the audience is free to ask questions to Dr. Shah. And yeah, let's see how this goes. So without further ado, we would like to begin the oration. Dr. Shah, the floor is yours.
Oh, thanks, Nior. And thanks to the World Youth Heart Federation for inviting me to deliver a talk on oration on what is the future of heart transplantation in India. I really admire that you have selected this topic at the onset, and with the youth in this federation, I think so this topic may have a long lasting effect, because that is what we really want in India, so that more and more heart transplantations do occur. Uh, I would also like to thank Shweta, to Diksha Joshi and Prashant, who are all the team members and who are the post holders of this organization, for inviting me this talk. So let me share my screen and then let's talk for this. So I always start my lecture with dedicating or praying to the two foremost people in the transplantation. One is the first transplant surgeon, that is Shiv Bhagwan, who was, I consider, as the first transplantation because he did the first head transplant, which still is not possible in medical science, of Lord Ganesha. So, with this prayer to these great people, let us move to the topic. I would just like to share a small story of mine, myself. In 1995, I think so, the pager system was introduced in India, and then later on, the mobile systems, and then these things came in. When mobile was introduced to India, uh, I was not very excited. I was not very enthusiastic to have that mobile in my hand. And I always used to say, it's not required. I already have a landline phone. So it's okay. No need of having a mobile. But yes, over a period of time, when I saw it, the utility, its functionality, I bought a mobile in 2000. Then a time came when that simple mobile became more complicated mobile. It became a smartphone. And again, that same question was asked by me, and people were forcing me. Okay, see, now the world has changed. Now the new thing has come up. There is a smart mobile with a smart watch, and everything is smart. You should update yourself, and you should also buy a smart mobile. See, after a period of almost another 5 6 years, I got interested, and then got my first smartphone, a smart mobile. So that is how I came into this system of smart mobiles, that is in 2006 or 7. But if you look at this picture, this is my mother's picture. She is on a smart mobile, surfing Facebook, surfing Instagram, surfing WhatsApp. So this is how, over a period of time, people start accepting things. Otherwise, my mother itself used to say, "Okay, keep this mobile aside. It's a useless thing. It's a not of worth. So don't use it." And now herself, she is addicted to a mobile, and people have accepted it so simply. The purpose of telling this story is very simple thing. When an heart transplantation concept was introduced in India way back in 1994, the people did not accept that concept. They say it's not possible in India. Here the technology is not there. People will not understand what is brain dead. People will not come forward for the organ donation. And that is the reason why the heart transplantation program did not develop in India. And we will be talking about this thing. But now, over a period of time, what I am looking forward and what I'm envisioning, that more and more people are accepting that it is a new technology, new advancement, new science that will give a decade or 2 decades life to a person who is not supposed to live for even 2 years also. So obviously every time there is a protest against the new technology, but then over a period of time, everybody accepts that technology. So what is organ transplantation? Organ transplantation is the moving of an organ from one body to another for the purpose of replacing the recipient's damaged or failing organ with working one from the donor side. Donor organs can be living or deceased. And organ transplantation somehow has always been lagging or uh, has not been picked up in India because of three special reasons. Because organ transplantation is a special because it involves the medical issues, it involves ethical and social issues, and there are legislations and organizational issues there. So to focus all these issues to one point, and when this all 3 points comes together, then and then it's only possible that you can do or run a successful organ transplantation program. There has been issue at each and every level since last probably 3 or 4 decades, and now slowly we are being picking up, and now it is system is getting established. Everybody may be knowing about the kidney transplantation and liver transplantation because they are more established as compared to the heart transplantation, and are being done since last 30 40 years now in India also. But how is heart transplantation different from rest of the transplantation? Purely heart transplantation is a cadaveric transplantation. So there is no option of live transplantation. A person becomes brain dead. If the family agrees to donate organ, then and then heart can be taken or removed and can be transplanted in the patient. So it is totally dependent on cadaveric transplantation. Usually, once the heart transplantation is done, if the heart doesn't work, if the heart is not accepted, then there is no second chance. Whereas in kidney transplantation, if the body doesn't accept the kidneys, the patient is back to, I would say, dialysis. So patient life is not at stake. Whereas in heart transplantation, sometimes the life is at stake. So there is no second chance in heart transplantation. Second, a third very important point is the ischemia time. Ischemia time is the time taken once the heart is removed from a brain dead patient and transplanted in a recipient. Heart has the shortest ischemia time, that is just 4 to 5 hours time. And that is why you have to complete the whole process of retrieval and transplantation process. So this is again a very unique feature of heart transplantation. Should not use suboptimal donor. Again, because of the second point, there is no second chance. We as a cardiac surgeons or transplant surgeons are very choosy. We don't accept any suboptimal organs. We always try to go with the best of the organs so that we can give a good quality of life to the recipient and a best results. Now, another very important thing which has come up is then alternative options for heart transplantation because of the acute shortage of organs, and we are not able to treat many such patients. Science is coming up with an artificial hearts, that is LVADs and total artificial hearts, which is a very promising future. And I probably, over a period of another 10 years or 15 years, they may take over the heart transplantation because sheer shortage of organs everywhere. And last but not the least, heart transplantation is with lot of glamour in it. Whenever a kidney transplant or liver transplant is performed, people don't take notice of that. But when it is a heart transplantation, immediately it is there everywhere. And that is the reason why it is more glamorous. So, what are the indications for heart transplantation? If I talk in a very simple language, if the heart functions or ejection fraction of the heart is less than 20%, patient is unable to do his routine activities also. So NYHA class 3, 4. What are the causes of poor function of the heart? There are many causes of that, and most common is the heart attack and sometimes the idiopathic dilated cardiomyopathy. That means the patient is having a weak heart right from the birth, the muscles are weak, and there is no pumping capacity. Then there are patients who have the valvular heart disease. They also, over a period of time, their heart becomes weak and they end up in heart failure patients with EF of less than 20%. There is special category of postpartum dilated cardiomyopathy and congenital heart disease. So these are the patients who ultimately land up into heart failure and then they need heart transplantation. And there is one special category also called an intractable arrhythmias. So once the heart attack occurs and somehow some part of the heart starts bursting or starts firing, the conductions, and that patients then have arrhythmias of the heart rate ranging from 250 to 300, and they are not being able to manage by shocks or medications or any other maneuvers, then yes, that patients can only benefit by heart transplantation. These are the ACC/AHA guidelines. I would not be going into much detail of this, but only one point I would like to stress upon. All patients of this heart transplantation who are prospective candidates for heart transplantation have to undergo VO2 max testing, which helps to identify whether that patient is a candidate for heart transplantation or not. Again, not all patients are a candidate for heart transplantation. Anybody with the EF of less than 25% or 20% cannot be offered a heart transplantation because there are certain contraindications, like the age is more than 65 years, or patient is having systemic infection, or patient is having malignancies, or a patient is having diabetes with end organ damage. End organ damage means having kidney disease, had an amputation, has retinal detachment. Then patients with marked obesity, BMI more than 30 kg per meter squares, or severe peripheral vascular disease, or patients having irreversible kidney damages, or liver damage, or lungs damage, or disease, they are not a candidate for heart transplantation. So practically I would say, if a patient is having heart failure, rest of his organs and rest of the systems should be normal, then and then that patient may have a good post-operative outcome after the heart transplantation. Last but not the least, psychosocial factors are very, very important to allow that patient to be a prospective heart transplantation, because compliance of the drugs, his or her support system is there or not, whether that patient is addicted or not, or that patient is having any psychiatric issues, this needs to be sorted out before that patient is listed for heart transplantation. So again, as I told about the contraindications, there is a very special window period. As we all know that once the heart failure sets in, rest of the organs also slowly over a period of time, they start degenerating or they start degrading. So the first organ to start deteriorating is always the kidneys, then the liver starts deteriorating, then lungs start deteriorating. So once that sets in, then definitely you are too late for a transplantation. So there is a golden window period, or we called it as a transplant window concept. It is in that period only, if you offer a transplant to a patient, then you get fantastic results and fantastic outcomes in that patient. So it's a balance between sick enough heart against well enough other organs. If you can balance that thing and offer that patient a transplantation, the results are good. What are the cornerstone of successful heart transplantation? First and foremost thing is the ideal donor. The donor has to be very good, a brain dead donor whose family has agreed upon to donate an organ, has to be less than 50 years. Ideally, it is, we always prefer to have organ from 40 years or less than 40 years. But world over now, they have extended to 55 years also, with no other issues or chest trauma. So these are all indications, or these are all points where we look into that. Okay, this patient is an ideal donor or not. If anything is negative in this, I would say checklist, then we normally don't take that organ and we refuse that organ. That is how I told initially also. We are very choosy. We don't select any suboptimal organs or suboptimal donor. So once the organ transplantation is, the patient is approved on the waiting list, gets an organ, then the whole system sets in. And at that particular point of time, I would say the it is a sort of a war zone or war room wherein everything starts at a very high speed, and within a period of almost 12 hours or 15 hours, the whole surgical process of the transplantation is completed. So once I get a call from the some place that there is a prospective organ donor, what I have to see is I have to see the blood grouping. And second thing, very important thing is what I have to see is about the body size or the weight of the patients. So because there has to be compatibility of two weights of the patient and the donor, recipient and the donor. And even the blood group has to be matched between the two things. So blood group matching is as good as what you do it for the routine blood group matching. So that is what we have to see. And third most important thing is the geographic location. Because if I get a donor in Chennai and I have to do a transplantation in Delhi, then technically and logistically it becomes very difficult. So always we try to find out the donor and recipient at a nearby center, and you should first explore that area and then move forward. So once the donor is identified, then as I had initially told, time is the cold ischemia time. The time is muscle. I have just 4 hours time, and within that 4 hours stipulated time, I have to retrieve the organ from the cadaver and transplant it into the recipient. So that is the reason why you have this all sort of hulla gulla, I would say, the systems going on everywhere. Like I need to have a charter flight. I need to have a green corridor. I need to have a fantastic coordination between the retrieval team and the recipient team. So that is how it goes on. And that 7-8 hours are a very hectic period wherein the whole process is completed. So this is how the whole process is completed once we get a call, and we finish it off within 4 to 6 hours. So what is the surgical procedure? You just remove the heart. You just keep back the aorta, pulmonary artery, SVC and IVC. I think so there are a lot of medical students over here, so they can understand all these technical terms. And then you take the heart from the donor and suture all these 5 places, that is the IVC, SVC, aorta, pulmonary artery, and left atrium. So all this suturing is done. So just I would like to show you a brief video of what all goes in the heart transplantation procedure.
मरने की कगार से मरीजों को जिंदगी की तरफ वापस खींचना सिम्स हॉस्पिटल को बखूबी आता है, और शायद यही एक कारण है कि गुजरात की बड़ी उपलब्धियों के सर का ताज है सिम्स हॉस्पिटल के नाम। हार्ट ट्रांसप्लांट एक ऐसी प्रक्रिया जिसमें सर्जन रोगी के शरीर से जीर्ण हो चुके हृदय को निकालकर उसकी जगह एक स्वस्थ हृदय को स्थापित करता है। अब ये जाहिर सी बात है कि आसान नहीं किसी का दिल किसी में धड़काना। आसान तो सिम्स हॉस्पिटल के लिए भी नहीं था 2016 में, जब मेधावी और कुशल डॉक्टर्स ने अपनी कड़ी मेहनत और लगन से गुजरात में पहली बार हार्ट ट्रांसप्लांट किया। जिसके बाद टीवी और न्यूज़पेपर्स ने उन्हें नवाजा। ये सिद्धि जो सिम्स हॉस्पिटल ने हासिल की है वो इसलिए क्योंकि यहाँ कड़ी मेहनत और नामुमकिन को मुमकिन बनाने वाले डॉक्टर्स हैं। आइए मिलते हैं अर्जुन भाई आमलिया से, जिनमें आज एक मुस्लिम युवक का दिल धड़क रहा है।
कोई आशा नहोती कि माणस जीवी सके, परंतु सिम्स हॉस्पिटल ने डॉक्टर टीम અને બધા બ્રધર્સ એન્ડ સિસ્ટર્સ બધા લોકોએ જે રાત દિવસ મહેનત કરી છે એ મહેનતથી આજે આપણે સફળ થયા, અને ભગવાન પાસેથી કોઈ પાછું લઈ આવી ન શકે તો સિમ્સની હોસ્પિટલે એ સાબિત કરી દેખાડ્યું।
सिम्स हॉस्पिटल के सफलता के किस्से यहाँ खत्म नहीं हुए। अब मिलते हैं कल्पेश कटोरिया से। वायरल इन्फेक्शन होने के बाद इनका पंपिंग कैपेसिटी सिर्फ 15% ही था, और इसकी वजह से हार्ट ट्रांसप्लांट ही एक विकल्प था।
હું એટલું કહી શકું કે ઓપરેશન પહેલાં જ્યારે મને કોઈ પણ પ્રકારનો પ્રોબ્લેમ નહોતો, જ્યારે મારી લાઈફ એકદમ નોર્મલ હતી, તો તેના કરતાં પણ અત્યારે ઓપરેશન કર્યા પછી હાર્ટ ટ્રાન્સપ્લાન્ટ કર્યા પછી એના કરતાં પણ મને બેટર ફીલ થાય છે। ખૂબ જ સારી એવી જિંદગી જીવી રહ્યો છું। મને આજે કોઈ પણ પ્રકારનો પ્રોબ્લેમ નથી।
बोहरा की बात करें तो इनके जरिए हिंदू मुस्लिम के बीच की एकता का संदेश कायम हुआ है, क्योंकि इनके पास जो दिल है वो हिंदू का दिल है।
मैं ऐसा नहीं कहता कि भाई हार्ट ट्रांसफर कराने के बाद ज़िंदगी लंबी हो जाएगी, ऐसा नहीं कहता। ज़िंदगी जितनी भी लिखी होगी वो तो रह गई, मगर आदमी सुकून से जी सकेगा।
और एक के बाद एक सिम्स हॉस्पिटल में सफलतापूर्वक हार्ट ट्रांसप्लांट सर्जरीज होती रही हैं। कारवां बनता गया है और लोगों में नई आशा की किरण जागी रही है सिम्स हॉस्पिटल के रूप में। पुरुष हमेशा स्त्रियों की ढाल बने हैं और उन्हें महफूज रखा है। बस इसी तरह इस किस्से में भी कुछ ऐसा ही है। रेखाबेन नावड़िया को 20 वर्षीय युवक ने दिल देकर नया जीवन दान दिया है।
ने आखिर एक सेवाभावी परिवाરના અંગદાનના નિર્ણયથી સિમ્સ ડોક્ટરોની ટીમની ખૂબ જ મહેનત અને ભગવાનની કૃપાથી મને નવું જીવતદાન મળ્યું છે।
ये लोग अपनी एक खुशखुशाल जिंदगी जी रहे हैं, जिसका श्रेय जाता है सिम्स हॉस्पिटल के डॉक्टर्स को। अत्यधिक अनुभवी डॉक्टर्स और नवीनतम तकनीकी से सज्ज सिम्स हॉस्पिटल ने अपनी सफलता से आज लोगों में अटल विश्वास की बुनियाद पर अपने अस्तित्व को कायम किया है। ऑर्गन डोनेशन की अवेयरनेस का श्रेय जाता है एनजीओज को। और ये बात भी नहीं जुटलाई जा सकती कि एक सक्सेसफुल हार्ट ट्रांसप्लांट के पीछे गवर्नमेंट, पुलिस और एयरपोर्ट अथॉरिटीज का बहुत बड़ा योगदान है, जिनके साथ के बगैर ये सैर तय करना नामुमकिन है। मुख्यमंत्री श्री विजय भाई रूपानी ने सिम्स हॉस्पिटल के दृष्टिकोण और उद्देश्य को सराहते हुए कहा कि सिम्स हॉस्पिटल ने चिकित्सा क्षेत्र में सराहनीय काम करके देश का नाम रोशन किया है और आश्वासन दिया कि राज्य सरकार इस कार्य में बनती सहायता करेगी।
राज्य सरकारनी पण फरज छे અને એટલા માટે ગ્રીન કોરિડોર એની વ્યવસ્થા આપણે બનાવી છે।
मुख्यमंत्री श्री विजय भाई रूपानी ने लोगों को अंगदान करने की अपील की और जिन लोगों ने अंगदान किया है उन्हें सम्मानित भी किया। सिम्स हॉस्पिटल has marked the beginning of revolution. Humanity has proven that when you start an honest task with clean heart, your task always becomes successful.
So that was the whole process that you saw in the heart transplantation program. And very rightly, it was mentioned in the whole video that this transplantation program is not dependent only on a surgeon and a patient, but it is really dependent on multifactorial people involved in this: donor, government help, then aviation help, traffic police help. Without that, heart transplantation is not possible. So now coming to what are the results of heart transplantation, let me tell you, over a period of last 4-5 decades, the results have improved significantly. And now we can have a survival rate of almost 90% at the end of 1 year. And the median survival means that 50 to 60% patients, they survive almost 12 to 14 years. So that is the significant improvement that we have achieved over a period of last 3 to 4 decades. If you compare it with a patient who doesn't get a heart transplantation, the figure at the left bottom, you can see if the patient is of heart failure with NYHA class 4, at the end of 1 year, 50% of the patients will die. And at the end of the 5 years, almost 80% of the patient will die if they don't undergo heart transplantation. But whereas if that same patient undergoes a transplantation, the chances of survival at the end of 5 years is almost 75%, and the end of 10 years, it is almost 50 to 60% survival rate. So it is a matter of giving a life of almost 1 decade to 2 decades to a patient who may not have survived for 2 years. And if you compare these results with the kidney and the liver transplantation, they are at par, and they are absolutely the same results. And this is one of the patients which I met in France when I went for the conference, Mr. Brent. He is 38 years post-heart transplantation and is doing fine. And now there are n number of patients who have crossed 20 years mark now, and they are doing fantastically nice. So what is the number of heart transplantations that we are seeing right now? I would say just the tip of an iceberg. if you look at the vast extent of the Indian subcontinent or India, we have a huge number of population and a huge number of heart failure patients. But unfortunately, they are not being diagnosed. They are not being, once they are diagnosed, they are not being treated properly. Once they are being treated, they are not given the option of heart transplantations. And once they are given the option of heart transplantation, unfortunately, there are only few people who are able to get that heart transplantation for various reasons. One of the biggest reason is the organs, they getting an organ at right time. Second thing is the financial issues, because most of the patients, they have issues with the finances, so they don't afford it, because right now the overall costing of heart transplantation is somewhere around 20 lakh rupees across India. So if you look at the history, the heart transplantation, first heart transplant was done on 3rd December 1967. So almost 50 years we have crossed that mark. And this is the data of the US and European countries. They are almost doing 3,000 to 4,000 heart transplantation a year. But in India, why did it not pick up? Why are we so behind in heart transplantation? I think so. The reason are n number of reasons, but important reasons are this: lack of awareness for organ donation. And as I said, it is purely cadaveric transplantation. So heart transplantation could not pick up because there was not significant organ donation awareness in India till 2008 or 2010. Lack of knowledge and results of heart, lung, liver transplantation among the physicians who are treating the patient and the cardiologists who are treating the patient and who are referring the patient for transplantation. So they never had that faith. They never had that knowledge that this can be done with fantastic results. So the patients were not referred. Cost and Indian psyche of not spending money for their health is also a big hindrance. Fourth, heart transplantation is a teamwork. A single person cannot perform the surgery and finish off the job. You need a huge team, right from the surgeon to cardiologist to anesthetist, the critical care specialist, ID specialist. Then you need to have physiotherapist. Then you need to have dietitian. You need to have nephrologist. So you need to have n number of people required to get a successful outcome. And last but not the least, lack of enthusiasm among the cardiac surgeons and other transplant surgeons to take up the challenge. Obviously, heart transplant or any transplant is a big challenge, and it frankly speaking, it removes your years from your life if you start or take this job of transplantation, because every time and every minute is important, and there is significance, I would say, release of adrenaline in your body all the time till the patient is getting discharged. So definitely that takes a toll on the patient, on the doctor and the team, and hence not many surgeons are enthusiastic for this. So if you look at the overall Human Organ Transplantation Act, that is, it was established in 1994, and the brain death acceptation for the organ donation was accepted in 1994, but it took almost 20 years to really establish this cadaveric transplantation program in India, and now gradually it is picking up. And what were the basic issues for the brain death concept, which are still the biggest issues right now also, is the awareness about the concept of brain death among the doctors itself. Most of the doctors, I would say, and I can bet if I ask what is brain death, not many knows about what is a brain dead patient. Nobody knows what is the definition of brain dead, which I always feel should be a part of your curriculum whenever a person is getting into medical admission. So it should be part of MBBS degree. A chapter should be there on organ transplantation and brain dead concepts. Second important issues which we are facing in India is the poor hospital infrastructure to support multi-organ donation, because there are very limited number of hospitals who can be a retrieval center or who can be a transplant centers, because you need a huge infrastructure and huge teamwork for that. And last but not the least are strong cultural and religious belief, which becomes a big hindrance for the organ donation. we have been trying to promote and trying to create an awareness of organ donation in India. And we have been partly successful. We all as a medical community, you people also as a medical community, everybody is working hard and creating an awareness. And I think so slowly the number of organ donations are increasing. Particularly, I would say the states in the southern India, Tamil Nadu, Kerala, and Andhra Pradesh, they are the front runners, and they have been showing the path to rest of the India that yes, organ donation can be done and you can save many lives. If you look at the data, this is the number of patients who are waiting for transplantation. 50,000 heart transplantations, 30 to 50,000 liver patients are waiting for liver, and 2 lakh kidney patients are waiting for the kidneys for transplantation. If we can increase the organ donation rate, then definitely we will be able to increase the number of transplantation in India, particularly the heart transplantation. These are the numbers of 2015. Probably there has been still improvement in the numbers of the organ donation rate. But if you can see, again, the western southern states, and particularly even the Maharashtra, they are the front runners in organ donation rate as compared to the northern India and the western India and the central India. So this is what the model everybody has to pick up. This is what we all are bound to increase the number across India. If we all join hands and work together, we can definitely increase that organ donation rate. If you compare the organ donation rate with the rest of the Western countries, then I would say we are at a very dismal 0.05% or 0.5%. That is the organ donation per million patient. The best countries in the world are probably Spain and Croatia, who have achieved a rate of almost 32 to 34%. US is 21% organ donation rate, and Portugal and every other countries are 17% organ donation rate. So if we are able to somehow increase this awareness of cadaveric organ donation per million from 0.5 to at least more, then definitely we can increase the transplantation program in India. Where do this organ comes? Most of the organs, they come, the cadaveric organs, they come from the road traffic accident patients only. If you look at the data of 2012, there were almost 160,000 road traffic accidents, of which if we consider 60% having head injury death, then 60% will be brain dead patients. If we can convert that, the whole chunk into organ donors, then we can have 80 per million population per year, organ donors. It would be the biggest organ donor country in the world. But yes, that is a long way to go, and definitely we will be able to achieve that in coming future. So if we can increase that organ donation rate from 0.05 to at least 10 per million donation rate, then at least we will be having 11,000 hearts, 11,000 livers, 22,000 kidneys, and 22,000 eyes. And that is how we can give life to so many people across India and save life and give a very beautiful and fruitful life, particularly in the heart failure patients who have been living a very terrible life. They are not even able to go from one room to another room. They are not even able to go once they come out from the bath, they have to sit for almost half an hour just to take rest. So we can give them a very productive life, a fantastic life by offering them heart transplantation. So I would say heart transplantation is a fantastic technology, a science that medical science has created and established world over. Now it is sort of a very well established protocol based system, protocol based surgery, I would say. If you have a fantastic team, infrastructure, good support from the government and good support from the people, population of India, then the days are not there that we may be the number one country doing the maximum heart transplantation across the world. At this point of time, let me tell you, you may be aware or not, I don't know, but we are number 2 country in the world doing transplantations. So we are doing maximum number of transplantation. It's only after the America, USA. But unfortunately, what is happening is our 80% of transplantations are live related. So the live person is giving a donation of kidney and liver to their relatives, near and dear ones, and that is how the transplantation numbers are big. But if we can increase this organ donation rate to 10 or 20, then I'm pretty sure no near and dear ones will be asked or required to share their organs with their relatives if we can have more and more cadaveric organ donation. So I think so future is great. And what is new which is coming up in Australia and England is the donation of the circulatory death. So this is a very good unique concept. Okay, once the patient dies or the heart stops working, then immediately you retrieve the heart from the dead person, put it on this machine, which we call it as a transmedic machine, wherein a perfusion is started in the organ again, and then heart starts beating. Once when we find out that the organ is now in good condition, after the perfusion of almost 6 to 8 hours or 10 hours, then that organ can be transplanted into the recipient. So this has two biggest advantage. One is you can have more number of organs by having organs from a donation from the patient who had cardiac arrest. And second thing is you can then transport these organs from long distance. So if I want to transport this organ from Chennai to Delhi, it will be possible, because otherwise my flying time itself will be 3 hours, and I don't have then time for the surgical time also. So with this, I can even fly for 7 hours, 6 hours, and I can preserve the organ and can use this. So this has been a landmark thing which has come up, and Australia and England are pioneer in developing this whole system, developing this whole fundamentals. And now almost 1/3 of the organ donation in UK are this DCD. We call it as a donation after circulatory death. So this was first popularized by Dr. Kumud Dittal in Australia. He is basically a Nepali surgeon. He's a Nepali cardiac surgeon, and he devised this whole system of reperfusing the organ and then using it. So thanks a lot. And this is what I feel is the future of heart transplantation in India. What is right now and what is the future? I feel there's a huge future, because now lot of young surgeons are getting into it. Lot of corporate hospitals are getting into the heart transplantation programs. So the infrastructure is getting established. Doctors are getting enthusiastic. What is required now is, I think, is the more and more awareness of organ donation, and more awareness of this treatment available in India for all the patients. And very important, and last but not the least, a significant help from the government of India. Government of India in this point is that they can help financially also, they can help in transporting the organs also, and they can help in establishing these green corridor systems and everything. Then probably we may be able to have a bright future for heart transplantation in India. So thanks a lot. And final message for everybody is, in this Corona and COVID time, is avoid men and instead follow women. And you can see the whole acronym. Thank you. Thank you very much.
Thank you for your insights and sharing your profound knowledge on the subject. And now I would like to open the floor for questions from our attendees. I would suggest if anyone has a question, you can use the raise hand feature on Zoom, and accordingly we will unmute the attendees who who wish to ask a question, and I think we can proceed with the question and answer session in that way. So everyone,
Even they can put it on
you
a
can
chat line. They can put it on chat line
you can even
also
put it on the
if they
chat
have any
line.
question.
Yes.
Yeah. I just wanted to know what is this federation, and it comprises of who are the people who are involved in this federation.
I'll take that question. Thank you for the question, sir. My name is Diksha Joshi, and
Yeah,
I am
Diksha.
Regional Director West at
Yeah.
WIHF.
Yeah.
So our federation is the full form would be the World Youth Heart Federation, and here we're trying to decrease the prevalence of cardiovascular disease in the future. So we realize that as youth, we have the power to do that, and we need to decrease the incidence of cardiovascular disease and the deaths caused by it, because it is the number one cause for deaths in the world. And it comprises of youth from all sectors. So it's people under 35 from all fields working towards the same cause. So did that answer your question?
Hello.
Hello, can you hear me? Am I audible? Sorry.
Hello.
Yes, sir, can you hear me?
Yeah, I can hear you. You can hear
Sir,
me, no?
yes, I can hear you, sir.
Yeah.
So could you hear my answer, or should I repeat?
Yeah, I partly could hear it, but it's fine. Fine. No, but that's a very good initiative. I think so. The youth is the future of India or any country. And if the youth understands the thing and takes it in his own hand, then definitely I feel the future is going to be great for India. And if you can reduce the cardiovascular death in India, I think so we will be able to reduce the number one killer, or uh, reduce the number one killer of India, that is the cardiac arrest or myocardial infarction, because India is considered to be the capital of the heart disease in world. So congratulations for creating this federation, and it's a really great initiative.
Thank you, sir.
Great initiative.
Neon, you can take over.
Yeah, so we are receiving a few questions. The first question is from Batul Bhatia. He's asking about the post-op care after transplant. So, sir, would you like to take that question?
Yeah, sure. See, post-op care is very important. And whenever I counsel any patient for heart transplantation, I always tell them the surgical part is a very small part in this whole procedure. It is the overall post-operative care which is very important, because these patients, they are receiving organ from another patient, so their body is going to reject it. So these patients needs to be on immunosuppressive drugs. Once these patients are on immunosuppressive drugs, they have their own issues also, because if your immunity is suppressed, you are liable, or you have a chance of getting infection. And if you stop this immunosuppressive drugs, then your body is going to reject it. So lifelong these patients will be on immunosuppressive drugs, and lifelong these patients need to be in close follow-up with the doctors. If these two things are taken care of, I think so overall the results are good. Yes, the expenditure, because of the cost of the follow-ups and the medications, initial first year the cost is almost 15 to 20,000 per month, and after 1 year is over, then the chances of rejection and infection are less. Then the cost of the medication and everything per month goes down to almost 3 to 4,000 rupees. So I think so This is very important. We need to take care of that. And in long run, over a period of time, let me say after 10 years or 15 years, because of immunosuppressive drugs, then the issues of the side effect of immunosuppressive drugs, they creep in. So these patients may have issues of hypertension, of diabetes, having kidney issues, renal issues, and in rare cases even malignancies, like I would say lymphoma or skin cancers. So this all creeps in after the person survives for 10 to 15 years of heart transplantation.
Thank you, sir, for your question and also for your answer. And thank you, Batul, for the question. The second question is from Dr. Shobhit Raj. He is actually linked, he has sent a link of a study which says that, says, does cardiac transplantation change the personality? So he's asking if your view on whether changing the heart can change the personality traits of the patient, maybe the tastes or any other such thing. So in your experience, is this true or is this just a hoax?
Very fantastic question, I would say, and very interesting question. I would say there have been studies, there have been some case-to-case, I would say some case reports or some people expressing certain ideas. But practically, scientifically, if we look into this data, there is no such a change in the I would say personality of the patient or their likings or disliking or anything. The person remains the same what he was. But yes, there are new studies which are coming up which are showing that even the heart muscles, they have a memory. So I don't know, we need to study this in detail over a period of time and we may come out with some very fantastic or interesting data. But there are certain case reports who have suggested that I'm having a dreams of these things, which the donor had that same issues. So these are only some case reports, but in my own experience of almost 11, 12 transplantations that I've done in Gujarat right now, and no such significant thing I have noticed in the patient or the relatives have told, okay, that person has changed, that person was not liking this and now he's liking this. I have not seen that thing.
Thank you for your answer, sir. And thank you, Dr. Shobhit Raj, for the question. The next question comes from Hari Priya. Technology in the field of cardiac surgery. So is there a possibility that robotics or automated technology may overcome the employment or the role of doctors in this field?
I don't think so. Robots are ultimately robots, and robots can only work with the help of the humans only. So that thing we have to always keep in mind. See, ultimately in robots also we will have to feed in things. So whatever the robots are there right now in the medical field, it is ultimately the surgeon who is operating. Surgeons, every control is there is in the hand of the surgeon only. So independently robots cannot, I would say, take over the function of a surgeon anywhere. Yes, there are systems which are coming up for the diagnosis, like the Watson, IBM Watson system is there, wherein you feed in lot of data about one particular disease, and when you search for the diagnosis of certain patients, they may come out with a diagnosis. So that is a real possibility. IBM Watson is doing that thing, and they are collecting data for each and every disease, and based on that, they come out with the diagnosis with whatever the data that you enter. That patient will enter X, Y, Z, all the entries, and they get the diagnosis of that. So that is possible, but for the surgical field, I don't think so. It will replace the surgeons for in another near future for another 20-25 years. I don't foresee it.
Thank you, sir. And thank you, Haripriya, for the question. The next question comes from Shreya Mittal, and she's asking, what is the future of stem-derived heart muscle transplant?
Sorry, I could not get your question.
I'll repeat the question.
Your voice is breaking. Your voice is.
Okay.
If there is further.
Can you hear me clearly now?
Yeah. Now it's clear.
Okay. So the question is, what is the future of stem cell derived heart muscle transplant?
Yeah, again, a very fantastic question. And lot of studies, lot of experiments, lot of, I would say, datas are there. In fact, I was also involved in the stem cell therapy for the of the heart attack patients or heart failure patients. We have also injected the stem cells into the myocardium, studied in 20 patients, but unfortunately, there are no significant changes. When I visited a stem cell conference in Bern, that is 7 or 8 years back, the consensus of that, it was a conference of international conference or conglomeration of all the societies of the world. And the conclusion of that conference was still that the stem cell is still in an infancy stage. It is possible to culture the myocardium on the petri dish. I can create or I can generate a myocardium which is contracting on a petri dish. But when I'm trying to regenerate that same myocardium inside the heart, injecting inside the myocardium and thinking that myocardium will get converted into the whole thickness of myocardium, it is still a long way to go, because we are still not able to understand what happens at micro level or a very cellular level, how the arteries are getting established, how the roots are getting established, how that myocardial cell is getting converted into a routine myocardium or a conduction system or any other myocardium. So that we need to really understand, learn the things, and then we may be able to do this stem cell therapy. But at this point of time and in near future also, I don't think so stem cell therapy has any great future or it is going to replace certain things. But yes, the science is working on it, and another 15, 20 years, 30 years, we may have something very fantastic thing.
Thank you for your answer, sir, and thanks to Shreya for the question. The next question comes from Alia Rahmani, and she wants to know if there are certain complications in a bypass surgery. Then is heart transplant a last option, or is there any other option which can be which can help reverse these complications?
See, bypass surgery is done for the patient who have a blocks in the heart. And definitely it's now a very common surgery, a very well-established surgery for almost now 60 years. So normally I don't think so there are much complications of bypass surgery. Only if the patient itself is bad or the patient's heart condition is pretty bad, then that patient may end up in complication, or patient may have some other issues. But yes, if the patient after bypass surgery, if his pumping is gone down significantly, and if the patient is throwing arrhythmias, then heart transplantation is an option. You can offer that patient a heart transplantation. And I have few patients who had an MI, who had a heart attack. One patient I operated, fifth heart transplant was bypass surgery with valve repair was done. And after 3-4 years, the patient did not do well and his pumping went down significantly further. So I had to do a heart transplant in that patient after 3 years of his previous surgery of bypass surgery and valve repair.
Thank you for your answer, sir, and thank you, Alia. The next question comes from Dirgha Patel, and she's asking, why does bradycardia Why can't bradycardia be managed by atropine in the allograft? And how do we manage bradycardia in the allograft?
Which allograft? I'm not able. Means she's asking for what particular case? See, bradycardia, temporary bradycardia can be managed by atropine. You give an injection and the heart rate increases, but that is always a temporary phenomena. If you want to have a sustained effect, there are certain medications like orsiprenalin, isoprenalin derivative drugs that you can use it for, again, say 1 or 2 days or 3 days. If in that period of time also the heart rate doesn't pick up, then you have only one option, and that is the pacemaker option. So that patient needs a pacemaker.
Thank you, sir. I hope, Dirgha, that answers your question. We are having another question from the YouTube section, where one of the viewers is asking if there's any age restrictions when it comes to transplantation, or is transplantation possible in every age group?
A very good question, which I unfortunately could not touch on that point. But yes, we have age limit of 60 years in India right now. We offer heart transplantation to patients who are less than 60 years of age. That age limit has been increased to 70 years in Western countries, particularly in US, wherein they do transplantation even till the age of 70 also. But India, we have restricted it to 60 years of age, because what we feel is, okay, we would, as such, there is a shortage of organs in India or everywhere. The organ should go to a person who is in a middle of his life, who has to live another 30-40 years. So maximum benefit can be given to that patient. So that is the reason why we have this. And second important reason of less than 60 years is, as you age, there are a lot of other comorbidities that you get in, and may be having other certain issues also regarding other organs or other systems also. So with that multiple comorbidities, heart transplantation results are not good.
Thank you for your answer, sir. And the next question comes from Anish, and he's asking if you could throw some light on the sensory and sympathetic parasympathetic reinnervation post-transplant.
Very intelligent question. Once you do a transplantation, or once you transplant or remove the heart and you're putting a donor heart, that organ is totally denervated. And we never try to even do a reinnervation. So that heart is totally denervated. And that is the reason most of the patients who after heart transplantations, they have higher heart rate. And we always try to keep the heart rate more than 90 or 100, around 90 and 100. We don't try to reduce the heart rate, because that patients will not have that the response, your exercise response, or your adrenaline response, sympathetic response or parasympathetic response, because they are denervated. So we always try to keep the heart rate between 90 to 100 in all this patient. Second very important thing to be understood from this denervation of the heart is this patients, if they later on, after say 10 years, 15 years, if they have coronary blocks and then they have an MI, they will not have any sensations. So these patients, they will have silent heart attacks, and they don't have the chest pain or that cardiac pain that is sometimes felt in myocardial infarction. So that again has to be kept in mind. So you have to be very vigilant for heart attack by just looking at the ECGs. So a very good question. All the all the hearts are denervated, and we have to manage that denervated heart. But yes, through the blood stream, through the blood, adrenaline can act on the heart and can increase the heart rate, but not through your sympathetic or parasympathetic drives.
Thank you, sir. The next question is from Srushti. She's asking if you could share your thoughts on the development of bio-based stents and what was lacking in these bio-based stents that they weren't accepted as much as the metallic ones.
See, biodegradable stents were basically stents thought that because the routine stents that we are using are a metallic stent. And when the metallic stent are put inside the body, definitely body is going to react against that foreign body or foreign material. And that is the reason why there is instant restenosis after certain years. So to remove that foreign body reaction, this concept of biodegradable stents came up. So it was decided, or it was devised, that over a period of 1 year or 1.5 years, that stent should get dissolved and should get removed. But unfortunately, what happened is we could not achieve that long-term results that we were able to achieve with this drug-eluting stents. Second thing is, you always need a scaffold to keep that artery open continuously. Otherwise, what happens that because that scaffold is removed, the heart arteries, they get collapsed. So there are multiple reasons why this did not pick up, but yes, still there are I would say research and scientific work going on to create a good biodegradable stents which can have a good, fantastic results equivalent to drug-eluting stents.
Thank you, sir, for your question. Just a small announcement for the audience. We'll be taking 5 more questions because we have certain time restrictions too. And after 5 more questions, we will then be concluding the session. So the next question comes from Shubham Agrawal. He is asking, how do we control irregular heart rate post-transplant?
It is basically controlled by the beta blockers. Beta blockers are the mainstay drugs for all the post-heart transplantation patients. And if there are irregular heartbeats or if there are other arrhythmias, then obviously the Codron is the drug of choice. So these are the 2-3 drugs that we routinely use. But important drug is always the beta blockers.
Thank you, sir. The next question is from Alia, and she's asking about heart conduit surgery. If you could shed some light on heart conduit surgery.
Pardon? Heart?
Alia is asking if you could shed some light on heart conduit surgery.
Heart conduit surgery.
Is my voice clear?
Voice is clear, but the question I could not get it. What is heart conduit surgery? I am not aware of that. Sorry.
Okay, maybe Alia, you could elaborate on that till then we'll move to the next question. The next question is from Dr. Shobhit Raj again. He says, as you were talking about not taking any suboptimal donor, my question is, does the optimal health of a recipient, is that taken into consideration, as in if there are any other issues unrelated to the heart, for example, hepatic failure or autoimmune disorders or a systemic infection, is that counted when it comes to surgery?
Yeah, definitely.
Or choosing a suboptimal donor?
Yeah, that is what I had elaborated it. Okay, if a recipient is having any issues, there is a list of contraindication, and that patient is not listed for heart transplantation. If that patient is having hepatic failure, or patient is having autoimmune disorders or systemic infection or HIV malignancy is there, then that patient is definitely not listed for heart transplantation. So that is why whenever a patient comes for heart transplantation, we do a detailed body evaluation, complete evaluation of the patient from head to toe. And if anything is abnormal, then that patient needs to be treated first. And after treatment, if it's still patient is okay, then and then patient is listed for transplantation. I think so I was able to answer that question.
Yeah, thank you, sir. The next question is from Puneera. He's asking, after transplantation, is the emotional influence on heart gone?
Great. No, it's not that. See, emotions are always there, and we all know, we are all medicos, that emotions are all over here. Emotions are not here. But yes, the emotions that creating parasympathetic and sympathetic drives, that are removed. So once you have an emotion, and when your heart rate should increase because of that emotion, sometimes that is not there, and that may be the reason why people, they say that a person becomes emotionless. But no, it is just your thought getting converted into a tachycardia is stopped, but your thoughts are always there, so you will be emotional.
Thank you, sir. The next question is, does LVAD delay the need for heart transplant?
Can you repeat the question? Sorry.
Yeah, just a second. I'm actually experiencing some network problems. Could Diksha please take over for a minute? I'll just reset my network and get back.
Yeah, yeah. Okay, so another question that we have is, how do we control irregular heart rate post-transplant? Has he already asked this?
Yeah. This I've answered it.
What is the scope of soft robotic sleeve? Researchers are working on it as it was failed in prior attempts.
I'm not aware of that. Sorry. Robotic sleeve, I'm not aware.
Okay. Um, Another question we have is, does the left ventricular assist device delay the need for a heart transplant?
Yeah. Very good question, and that is what I had pointed out in my talk also. Now the medical technology is moving forward to create a system which can take over the function of the heart. So one of the system is LVADs, left ventricular assist device, and second is the total artificial hearts. So basically, LVAD is for the patient whose left ventricular function is very poor, and you can implant that LVAD inside the body, and then that patient again can be mobile and can move around. In US and in Europe, the patients who are waiting for heart transplantation, if they deteriorate, if their condition, medical condition deteriorates, then that patients are offered an LVADs, and on that LVADs they can continue for a few months. In the meantime, then again they get an heart, and then a heart transplantation is performed. And then there are second category of patients also, wherein the patient is not a candidate for heart transplantations. For example, he is more than 70 years of age, or he is having kidney problems. And in that category of patient, you can give an LVAD, left ventricular assist device, as a destination therapy. So with the help of that LVAD, patient may survive for another few years with that machine.
Thank you, sir. I think that was the last question, and
Thank you.
we're sorry to have gone over time.
No
Um,
issues.
on behalf of the Health Education Committee of WIHF India, it gives me immense pleasure to propose the vote of thanks. We're immensely grateful to you to accept our invitation and also take the time off of your busy schedule and be a part of this event. Thank you for sharing your profound knowledge and insights on this topic.
Thank you.
Last but not the least, we'd also like to thank the attendees for joining us and being a part of this webinar. I'm sure each of us here is going back with a wealth of information of heart transplant surgery, and we hope we can carry on your legacy in the future. Thank you so much.
It was great, and hope I was able to deliver some knowledge to you, and it would be some help to everybody of you. So thanks a lot, and congratulations and best wishes for your future endeavors, and hope that you reduce the cardiovascular death in India and this hotspot of cardiac disease of the world, and you may be the torch bearers of this. Thank you very much. and best of luck. Thank you.
Thank you so much, sir.
Thank you.
We'd like to also request everybody to please fill in the post-event form that has been sent on the chat. Thank you. Thank you all for tuning in.